Hi, I'm Rima Jolivet. I am the director of the Improving Maternal Health Measurement Capacity and Use project that we just referred to as the project here at the Women and Health Initiative at the Harvard T.H. Chan School of Public Health. And this is the first presentation in our online technical consultation aimed at exploring additional indicators to fill identified gaps in measures for EPMM. I thought that our first objective during this online consultation is welcome and orientation, and I thought it would be helpful to provide some background about the work to develop the strategies toward ending preventable maternal mortality, the monitoring framework, and the current project to improve those measures. So just to start out with why we're all here, the broad goal of this online technical consultation is to explore the conceptual clarity, the need, the feasibility, utility, and eventually to propose full metadata for selected additional indicators to address identified gaps in maternal health measures. To meet this goal, as I said, I thought some background information would be helpful to provide the context for this particular activity. So what I'm going to cover today in my presentation, I'll go over the strategies toward ending preventable maternal mortality, how they were developed, and particularly the 11 key themes that are highlighted within the strategic report, the development of the EPMM monitoring framework, particularly focusing on phase 2 of indicator development, which was looking at policy and health system indicators, upstream indicators to track distal determinants of maternal health and survival. And then I'll provide an overview of the project and talk about how it builds on the work previously to develop those phase 2 indicators and aims to contribute to a robust comprehensive menu that countries could choose from and provide options of indicators for monitoring progress toward achieving all the priority recommendations in each of those 11 EPMM key thematic areas. This project includes a commitment to address requests by EPMM stakeholders and stakeholders for additional indicators to fill identified gaps. So first of all, I'm sure all of you are familiar with the EPMM strategies. Nevertheless, I wanted to talk about this direction setting report. It was released in 2015 at the launch of the SDG period, and it outlines global targets and strategies for reducing maternal mortality and actually for achieving optimal outcomes for maternal health and survival within the Sustainable Development Goal period. And it was developed through a broad range of consultations through different modalities that were supported by members of the EPMM working group. That working group is led by the World Health Organization and included members from other UN agencies, from donor groups, from implementing partners, civil society organizations, a range of different perspectives and leaders in maternal health, but nevertheless, because it was a rather small and primarily global group, the way that the group worked to try to develop these strategies was through broad consultation. This included national dialogues supported by civil society organizations in several countries. It included webinars, it included targeted consultations, and it included an official member state consultation convened by the World Health Organization. And the result in asking the question of all these stakeholders about what should be the top line objectives for achieving the ambitious reduction targets for maternal mortality are these 11 key themes that include guiding principles, cross-cutting actions, strategic objectives, but it's easier to think of them just as the 11 key themes of the strategic guidance. And here they are, and they're important because, again, they form the foundation or the basis for which the set of EPMM phase 2 indicators was developed. It was developed to try to find the strongest indicators available to drive and track progress toward these key themes, which start, as you can see, they represent the full spectrum, the broad range of determinants that impact risk to women and girls for maternal mortality, starting with empowering girls and women and families and communities and running all the way through the spectrum to accountability systems, mechanisms, and passing through governance, a human rights approach, improving metrics and data quality, financing, adequate resource allocation, addressing inequities, universal health coverage, all causes of maternal mortality, as well as morbidity and health system strengthening. So as you can see, it's really the full range of determinants. Following the release of that strategic document, the EPMM working group agreed that the next thing that that group could do to help advance achievement of those strategies was to work to develop a monitoring framework for countries to be able to use and pick from to drive and to track progress in those areas. And so, as I said, this work was undertaken in 2 phases. This particular activity in the project focuses on phase 2. Phase 1 was really about trying to achieve consensus on a minimum data set of core metrics for maternal health that all countries should be reporting for global comparisons. This again is the minimum data set of counting, so inputs, coverage of key interventions, and major outputs. So it was really a consensus process that was concluded in 2016, whereas phase 2 was intended to develop a menu of indicators for tracking that full range of determinants reflected in the 11 key themes, so the social, political, economic determinants of maternal health and survival. And the hope was to create a menu that countries could adopt within their national monitoring frameworks, should they wish to try to focus on driving progress in those areas in the specific context of maternal health and survival. That work was completed in 2017. The paper was released in 2018, and I wanted just to share a little bit of the methodology. So what we did is we started again with those 11 key themes in the strategic document and the priority recommendations for each theme. We mapped existing indicators that could serve to track progress in the areas under each key theme linked directly to those priority recommendations. Then we convened a specific group of experts for each topic that included technical measurement experts, policy experts, and country-level experts from each thematic area. And we held separate focus groups for each of those themes. And we asked experts to evaluate the existing indicators based on specific criteria and to answer the question, what are the up to 3 strongest existing indicators for this particular theme in the specific context of maternal health? The result was a set of core EPMM phase 2 indicators intended to form a menu of proposed measures for tracking progress toward ending preventable maternal mortality in those thematic areas. And here are the criteria that we used. The primary ones were relevance, importance, usefulness, and interpretability, and secondarily, validity, feasibility, data availability, and harmonization with other efforts. And I say secondary because we really wanted to push the envelope. We understood that, we're hampered and limited in our ability to measure some very critical constructs, and nevertheless, in order not to let the perfect be the enemy of the good, we felt that it would be useful to try to push the envelope a little bit and to recognize those limitations and not let them hold us back entirely. This is the paper that resulted from that process. It describes the process and outcomes, and you also have it in the background file of background reading material on the Harvard Canvas site for this consultation, as well as in emails that have been distributed to you in advance of this consultation. And during that process of mapping, evaluating, and rank ordering the up to 3 strongest available indicators to track progress toward each of those EPMM key themes, inevitably in every single case, gaps were identified. Stakeholders requested additional indicators or modifications to existing indicators. They found things that they felt were missing to drive and monitor progress in each key thematic area that would be, which would strengthen measurement in those areas. So I think it's important to note that the things that were asked for represent wishes, the aspirations. It's really a wish list, not a list of indicators or measures. And I say that because from a technical standpoint, the aspirational ones and the ones where modification were requested as well, they reflect challenges when it comes down to measurement. But nevertheless, they represent also what stakeholders felt were critical gaps in available indicators. From a measurement standpoint, they can all be considered aspirational. They all have a need for further consideration, development. They're not really finished metrics. Rather, I think the important thing to keep in mind is that they reflect constructs that stakeholders on the ground felt were missing and important for measurement. That brings us to the current project, the Improving Maternal Health Measurement, the project, which launched in 2018 and will run through 2021. Its primary outcome is to contribute to a well-developed, research-validated monitoring framework for ending preventable maternal mortality. And it also includes, as part of that, work to engage at the country level with decision makers and stakeholders across the spectrum to bring attention to these upstream distal determinants of maternal survival and to the importance of monitoring in those areas. As I said, during that initial work by the EPMM working group and stakeholders to develop those indicators, in each area, for each key theme, stakeholders identified gaps and requested measures to fill them. And some of the requests were for a completely new aspirational indicator. Others were for a modification to an existing indicator. But as I said, I think it's important for us to consider them all aspirational because they all need work for further development, which is why we committed to address that during this project. So the first thing that we did when we started the project was to try to affirm the demand. As I said, the EPMM Phase 2 indicator development work happened in 2016, 2017. There were over 150 participants from over 78 organizations in numerous countries around the world. Nevertheless, time had gone by, and we wanted to make sure that the demand was still relevant. So in the first 2 years of the project, we conducted 7 national multi-stakeholder dialogues. The purpose of these dialogues was to convene and support a platform for dialogue of national stakeholders from across the spectrum of issues represented in the EPMM 11 key themes, and to provide a platform for discussion of distal determinants of the social, political, economic determinants of maternal health, those upstream determinants that could be either catalytic or sometimes stumbling blocks to achieving accelerated reduction in maternal mortality. And so in each dialogue, we considered those 11 key themes, stakeholders evaluated them and picked the top 3, and then looked at what they might like to measure as a result of those self-identified priorities. And in the context of those dialogues, we also shared the list of requests for additional EPMM indicators to be developed. And we polled the national stakeholders who were gathered on which were important in their context. And those that were ranked very important on a 4-point scale by a majority of respondents in all the countries where we went were prioritized for consideration during this upcoming technical consultation. And I think it's just important as we go into this consultation and this deliberation to have the history of where these emanated from, how they originated, and how they were prioritized. So using those inputs, the list of constructs that were ranked very important by a majority of country stakeholders, we brought it back and we asked our Project Advisory Committee to review it last July in 2019. Our Project Advisory Committee includes members from the World Health Organization, from UNICEF, UNFPA, academic measure developers, etc., and also sort of an attempt to reflect that range of issues. And so a selection was made from the full list of those that ranked very important based on an informal landscape analysis of global inputs to hear from our gathered advisory committee members what initiatives were ongoing, what work had been done in the interim, and which of the indicators that the country input suggested were very important. We could group in a way that we could convene experts to consider them. And therefore, the following list was prioritized for possible development into fully articulated indicators during this current consultation. And so here they are, and you can see that they're grouped by color into two broad groups. We, as you know, are hosting two simultaneous online consultations. Most of you are participating in just one based on your field of expertise and interest. And so the first one looks at 4 constructs that are related to concepts or issues of fundamental human rights principles like autonomy, accountability, and respectful maternity care. The second grouping focuses on improved measurement and use of data, particularly data related to counting, registering births and deaths and causes of death. And our agenda is to take these requests, now you know where they came from, and explore the conceptual clarity, the need for indicators at this particular level, which is primarily for national and subnational monitoring, also perhaps for global comparisons if appropriate, the feasibility, the utility, and eventually to propose full metadata for selected additional indicators if we deem that they meet those criteria. So what we'll do together, our objectives for this consultation are to review and clearly define the underlying construct for each indicator that we would develop, reach consensus on the need to develop such an indicator in this context at this level for national and subnational monitoring, and in those cases where we feel the criteria are met, to go forward and develop the full metadata for selected indicators, and finally to agree on optimal next steps for them, to include, I would say, plans for indicator testing and validation and how we might advance and strengthen them and share them. To help get us started, we've asked technical experts, we've asked deep content experts in each area to present the state of measurement with respect to the construct. For example, where has it been measured, how has it been measured, across what period of time has it been measured, at what level of the system, etc., if in fact that has been done, and then to summarize an argument from their perspective about the need for an indicator for monitoring at this level, and the feasibility. So before we jump in and try to develop any indicators for measuring each construct, we'd like to really carefully consider the feasibility and the challenges with respect to it. Most importantly, is it clear? Is the construct for measurement clear? Does it make sense? Are data available? Is this going to be feasible? How would it strengthen or complement existing efforts and make sure it lacks redundancy? We also want to think about the need. And again, I would venture to the gathered group, that we know that there are limitations in what we can measure, but as these are things that were identified as specific gaps toward tracking progress in key thematic areas, how important would this be? How useful? How readily interpretable? How could it point to areas for improvement? And I think that with this discussion, an in-depth discussion on and presentation on each indicator, then we'll be ready to move forward and consider whether it's appropriate for us to develop the full metadata. The expected outcomes of this consultation are a summary of our deliberations reflecting our careful consideration of requests that were made from global and national stakeholders for additional indicators to fill identified gaps. In terms of accountability, I feel a sense of accountability to those many stakeholders who expressed their aspirations around these constructs. In cases where our expert consensus is not to go forward and develop an additional indicator that was requested, the outcome will be a full explanation of the rationale for that. And in the cases where we do decide to go forward, the full elaboration of metadata for those selected indicators, for example, the indicator definition, proposed numerator, proposed denominator, proposed disaggregators, data sources, periodicity, all the nuts and bolts. For those constructs that our expert consensus supports meet those criteria of clarity, need, feasibility, and utility. So with that, I want to thank you. I want to thank you for your attention, welcome you once again to this online consultation. It's a great experiment, and we are so happy that you're joining us in it. And with that, I will end this presentation and open the meeting.